Welcome back. The topic today will be on best foods to eat for an enlarged prostate. Some food we will talk about in these videos have been shown to reduce the symptoms of enlarged prostate, and some have been shown to reduce the chances of having an enlarged prostate, and some have been shown to reduce the risk of prostate cancer. What is benign prostate hyperplasia, or BPH? It is an enlargement of the prostate gland. BPH is a common condition which occurs in men, especially over age of 50. BPH makes it difficult to urinate and may cause frequent urination as the enlarged prostate gland puts pressure on the tubes connected to the bladder. If left untreated, it can lead to urinary retention, prostatitis, infection, and higher risk of prostate cancer. The cause of BPH is not well understood, but could be related to hormones estrogen and dihydrotestosterone, or DHT, imbalance. Number 1 is foods rich in vitamin C. Vitamin C intake is associated with reduced risk of prostate cancer. You can get vitamin C from fruits and vegetables such as oranges, lemons, grapefruit, strawberries, tomatoes, broccoli, Brussels sprouts, cabbage, and cauliflower. Vitamin C evidence comes from this article: association between dietary vitamin C intake and risk of prostate cancer. Number 2 is fruits containing lycopene. Lycopene is the red pigment found in different fruits. Some studies have shown that lycopene can reduce the risk of prostate enlargement and decrease the size of already enlarged prostate. It can also reduce the risk of prostate cancer. Sources of lycopene include tomatoes, watermelon, grapefruit, papaya, and guavas, with tomatoes having the highest level of lycopene. Lycopene evidence can be found in these two articles. Article 1, lycopene and risk of prostate cancer, and Article 2, lycopene inhibits the growth of normal human prostate epithelial cell in vitro. Number 3 is nuts containing zinc. Prostate gland contains high level of zinc, and it has been shown that there is decreased zinc levels in patients with BPH. Zinc inhibits a hormone called 5-alpha reductase, which has been shown to play a role in prostate enlargement, as it converts testosterone into more potent testosterone known as dihydrotestosterone. It also inhibits prolactin. Zinc intake is also associated with reduced risk of prostate cancer. Sources of zinc include cashews, peanuts, almonds, legumes, sesame seeds, and pumpkin seeds. You can also take zinc supplement at a dose of 50 mg per day. Keep in mind, if you take zinc supplements, you may need to take copper as well, because if zinc levels increases, the copper level decreases. Zinc evidence comes from the article Comparative Study of Serum Zinc Concentration in Benign and Malignant Prostate Disease. Number 4 is foods containing beta-sitosterol. Beta-sitosterol is naturally found in plants, and it is similar in structure to the cholesterol that our body makes. It is great in reducing symptoms associated with enlarged prostate, such as improving urine flow. Sources of beta-sitosterol include avocados, peanuts, almonds, lentils, kidney beans, dark chocolate, and pistachio. You can also get it as a supplement at a dose of 60 to 150 mg twice daily. Beta-sitosterol evidence comes from these two articles. Number 1, beta-sitosterol for benign prostate hyperplasia, and number 2, double-blind placebo-controlled randomized comparative study on the efficacy of sitosterol enriched in conventional saw-palmetto oil in mitigating benign hyperplasia and androgen deficiency. Number 5 is vitamin D. Vitamin D binding receptors are present in prostate gland and bladder. Vitamin D seems to play a role in maintaining prostate health and size, and supplementation is associated with reduced risk of BPH. Sources of vitamin D include fish, such as salmon, and sunlight. You can also use vitamin D supplements, but remember, there are two forms of vitamin D. There is D2 or ergocalciferol and D3 or cholecalciferol. And if you prefer plant-based product, the D2 supplement will be better choice because it is derived from plants, and D3 is derived from animals. However, you will need a higher dose of D2 compared to D3. Other sources of vitamin D not mentioned here are not good for prostate health, such as red meat and dairy products. Vitamin D evidence evidence comes from these two articles. Number one, vitamin D in benign prostate hyperplasia, a review. And number two, vitamin D receptors as a therapeutic target for benign prostate hyperplasia. Number six is allium vegetables. And I know you're wondering, what are allium vegetables? So allium vegetables are flowering plants that include onions, garlic, scallions, and leeks. Studies have shown that increased consumption of garlic and onions is associated with reduced risk of enlarged prostate. The evidence can be found in these two articles. Article 1, allium vegetables and risk of prostate cancer, a population-based study. And number 2, onion and garlic intake and the odds of benign prostate hyperplasia. Number 7 is saw palmetto. Saw palmetto is derived from berries of dwarf palm tree. We are not exactly sure how it works, but there are some studies that show it can perhaps help reduce inflammation, prostatitis, and may also lower testosterone and may shrink the prostate gland. You can take saw palmetto as a supplement. Always remember to talk to your doctor or pharmacist before you start a new diet or start a new supplement, especially if you are taking other medications. Also, taking these supplements will not guarantee any type of cure for enlarged prostate, reducing your risk of prostate cancer, or anything related to any medical condition, because there are a lot of other factors involved, such as your diet, how much alcohol you drink, how much stress you're going through, medications that you might be taking, genetics, and other factors. Thank you for watching. If this has been helpful, hit that like button and be sure to subscribe for more health related videos. If you're already using these foods for your prostate health, please share how it has worked for you by leaving a comment below. Until next time, stay healthy and remember, health is the greatest wealth.